Hello students. Today we're going to be discussing the NEET PG recalls for forensic medicine and toxicology. I am Dr. Aditya and let's start off. So first thing I want to give is a disclaimer. Basically I want to tell you that the questions here are based on recall that I have received from students and they won't be completely accurate. Few options, few questions, few pieces of information here and there, but overall the gist of the question will be accurate. Second thing is, once the final questions are received, we will update it in due time. And also, all images used here are representative. They won't be the accurate images that were used in your exams, obviously. Now, the first question that they asked was, a man wearing a female dress and high heels and gets sexual pleasure from doing so with no sexual desire towards men. What is this condition called? Now, I have to add a note here. I don't know if it was clear that it said with sexual desire or without any sexual desire. Now, this is a very key and operative word because if there was sexual desire towards men, then perhaps they were trying to go towards sexual dysphoria. However, if it says no sexual desire towards men, then the correct answer would be transvestic fetishism, okay, or transvestism. Now, we did cover this. We did cover this in classes. Now, students, how do we approach this question? First thing to note is what is voyeurism or scotophilia? This is nothing but gratification by watching people undressing, bathing, basically watching them engaging in behaviors while they are unsuspecting. Then there is transvestism or eonism. Now this is gratification by wearing dress of the opposite sex. This is what was being asked in the question. Then there is sexual dysphoria. Now this is nothing but an incongruence between one's experienced or expressed gender and primary and or secondary sexual characteristics. Now clearly this is not what was being asked, so the answer here would be transvestism. Now where was this covered? We did cover this in our lecture video, specifically sexual jurisprudence part 1, then the lecture notes of the same, the MCQs and previous year questions. I have told you before as well, sexual paraphilias are questions which are very often asked and you should go through them. Question number 2. In medical legal exam of 18-year-old male who is accused of rape, he claims he is 16 years old. Which joints should be x-rayed to check these claims? Question is quite straightforward. What they're asking you is age estimation of an individual who claims to be a minor but is actually someone who is a major. He has attained age. So which of these joints will you x-ray? Now, can it be the head and shoulder, elbow and ankle, wrist and knee, elbow and hip? Which is it going to be? Now, I want you to think back to the identification class that we took, right? And look at this diagram over here. Very simply put, this is the exact same diagram that I gave to you in class as well, which is going to be most beneficial if you're trying to find out that the person is below a certain age. Now, you notice that the wrist joint is around 19 years. At 18 years, you have the shoulder and the knee. At 17, you have the hip and the ankle. And at 16, you would have the elbow. Now, most students will be tempted to pick 16. But if everything is fused, then the person has attained 16. So there would be no use of checking it. We want to disprove or also try and find out if 18 is a possibility. So our best option would be to try and x-ray the knee and the wrist. Now, if they had given shoulder and knee, that also could have been an option, but we need an upper limit as well. So therefore, wrist and knee are your best options. Now, this was discussed in the lecture video, identification part 2. We also dealt with it in the lecture notes and I went through it in the MCQs and previous year questions. Next, what is the sequence of rigor mortis in the human body? Is it head to foot to head, simultaneously appears everywhere, or does it go from center to periphery? Now, many students have erroneously selected this. Many of them think it's center to periphery because it first appears in the myocardium. But what they're actually trying to ask over here is how does it appear externally, right? So when you are actually doing a case and on external examination of the body, how will you first notice rigor mortis appearing in the body? You won't be able to visualize the myocardium. So actually what rule they're asking about is Nystein's rule. Okay, and that basically talks about how it is going to be spreading across the body in a proximo-distal manner or a descending manner, which means the correct answer would have been head to foot. Okay, so head to toe or head to foot. I hope you guys remember this table that I had very clearly showed to you and drawn your attention to during the lecture video of taphonomy part 2, in which I very clearly told you that you must remember that after myocardium, the path of rigor mortis is a descending pattern. Externally, the first site is the eyelids. Please keep this in mind and let's move forward. Next, question number 4. A child was born 8 months after the father has died. The grandparents filed a case disputing the paternity. The DNA was found to match the father's DNA. Okay, what will this child be called as? Very simple question. Okay, now let me just lay out the context. Basically, what has happened here is the child was conceived when the father was still alive, but the child was born after the father has passed away. So, in this case, would you say that this is a supposititious child? Until the DNA comes or the DNA result comes out, it is a supposititious child because we don't know who it supposedly belongs to. So it is a supposititious child. However, DNA is mentioned over here. They have mentioned that DNA was found to match the father's. So this cannot be the option. Then fabricated child. A fabricated child is one where the DNA does not match either the mother nor the father. It is a child that the mother or whatever supposed lady or father brings and says that this is this person's child. It's a child that is claimed to be someone's child, but it does have zero genetic relation to either parent. Okay, so this is also not an answer. Then illegitimate child. Does that apply over here? This illegitimate child is a term that is used for any child that is born out of lawful wedding or out of lawful wedlock. So is that the right answer? No. It says a child was born after the father died. Nothing over here has clearly told us that there was marriage, no marriage, nothing is mentioned. So the correct answer is a posthumous child. Okay. Now, what is the approach here? I have dealt with this under sexual jurisprudence part 3, and I have gone into detail about this, where illegitimate child is one that is born out of lawful wedlock, supposititious child, posthumous child, and even atavism. So I hope you've answered this correctly. Next question. Recording of evidence of a case of sexual assault survivor in court is done in. Now this question is a little bit open-ended. I don't know if the recall was given to me correctly, but some people are saying that the gender was specified, that it's a male survivor, some said it's a female survivor, whatever it is. Mainly in cases of sexual offense, what tends to happen is they want to try and separate the accused and the survivor. They do not want the survivor to relive the trauma. So they want to try and separate them. And so usually what tends to happen is a closed room proceeding. Okay. Now many students did select this option of closed court proceeding, which is not technically wrong. However, there is a better option available, which is hearing in camera. Now, an in-camera trial is one where the trial is held in secret, where only the people who have an actual interest in the case will be allowed inside the court, which means basically defending lawyer, the prosecuting lawyer, the accused, and the victim. They are the only people who will be allowed inside the court. Okay, so minimal number of attendants, no public people, no press, nothing like that. Okay, so this was also something that I had discussed. Now under closed court proceedings, it's a more general classification. You could under that have bi-camera trial and in-camera trial, which both come under those. But the more correct answer, I would have to say, between the two of these, I would say 4 is a better answer than 2. So option 4 would be the right answer. Again, I went through this in class under the video of legal procedure part 2, and also in miscellaneous forensic medicine and toxicology. I went over it a second time also, so that students would not get confused. I had drawn your attention telling you that there is a difference between camera trial in camera and bi-camera trial, and I very specifically told you it's a secret trial, only authorized people to maintain privacy, and sexual offenses, juvenile and national security cases are usually dealt with this level of security. Next. Question number 6. Police brought a person from the railway track with features of dry mouth, dilated pupils, dry skin, slurring of speech, altered sensorium. What is the most likely toxicant? Now, some students told me that they mentioned instead of cannabis, the option was given as alcohol, and some other students told me that instead of altered sensorium, it said staggering gait. But if you pay attention to the keywords that they've given here, there is no chance that you will go wrong. The first keyword is railway track. that should immediately tell you that they're asking for a railway poison. Okay, and next, dry mouth, dilated pupil, dry skin, slurring of speech, right? Altered sensorium, right? Or delirium. So what is this? It's a deliriant poison. So the best option over here is going to be Datura. Morphine, cocaine, morphine does not cause any delirium. Cocaine, Datura, and cannabis are known to be it causes delirium. However, amongst these, railway track is the thing that clinches it for you that it is Datura. Okay, so it has all the autonomic features of that. I hope you guys remember as far as how to approach this. The Datura fastuosa has 8 Ds, which is nothing but dilated pupils, dryness of mouth, dysphagia, dry and hot skin, drunken gait, delirium, drowsiness, and finally death due to respiratory failure. Also, 2 extra features you can keep in mind because this question may come again in some other form. And this was covered under miscellaneous toxicology as the video lectures and with the relevant lecture notes. Also very important, this has been asked previously. This question has come many times previously. So if you had gone through it, definitely you would have answered it. Next, question 7. Examination of a suspicious stain shows the following findings as seen in the image. What is this test? Now, what are you able to see in this image? You are able to see that the crystals are formed over here in somewhat of clusters, and they seem to be spindle or needle shaped, right? So they're yellow and they're needle shaped. So which of these is going to be? Now, before I tell you the answer, just think about it this way, right? What are these tests? This is Barbario's. This is used for semen analysis, right? Florence is also used for semen analysis. Both Teichmann and Takayama are used for blood stains. Okay. Blood stains, already it should tell you that most likely the stain is going to be reddish brown, brownish red, pinkish, around those. Whereas semen analysis, yes, it could probably come under one of these. Now, is this the best way to approach it? No. I'll tell you how to approach it in the next slide. Now, I want you to look at all 4 of these and understand that if you just go by the color of crystals and it's yellow, assume it's going to be Barbario because it is nothing but adding picric acid and that creates spermine picrate. That is what is giving it the yellow color. If it is reddish pink, that is Takayama, right? With usually it is going to be pinkish feathery sort of or frond like appearance as you see over here, right? So this is going to be your Takayama. Then you've got Teichmann. Now Teichmann over here, as you can see, you see brownish red crystals which are rhombic in nature, which you're able to appreciate over here. Now the worst possible stain to get in your exams is actually the Florence stain. And the reason why I say that is because Florence stain can be brownish red, right? And it can have needle shape and it can have rhombic shape. So usually it is not asked. So the thing that you need to keep in mind is Barbario's is also a question which has been repeatedly asked in the past. So therefore, I'm just going to sign off by saying that you would have realized this if we had gone through sexual jurisprudence part 2 and also the previous year questions. So I hope students you have gone through the previous year questions because this has been asked before as well. Next, question number 8. Dead body brought for autopsy shows the following finding as given in image. Which case is this finding suggestive of? Is it hanging, throttling, choking, or smothering? Now what does the image show? It shows the inner aspect of lips, right? Inner aspect of someone's lips are shown over here, and I can see that there is some lacerations, some contusions as well present on the inner aspect of the lips. Now in which of these cases are you going to find this? Let's go through the approach very quickly. Okay, if it is a hanging case, then they would have shown you a ligature mark, or they would have shown dribbling of saliva, which is an antemortem sign of that, of hanging, or sympathetic facies, which is nothing but one side the eye will be open, dribbling of saliva on the same side. Now, one thing that you should know is that in throttling, we're talking about manually somebody is using their hands to squeeze the neck of the victim or person. What are you going to see over there if someone is using their hands? You're going to see fingernail scratches, you'll see 6 penny bruises, the hyoid bone might be broken as well, and you'll see extravasation into the strap muscles. Now, what about choking? That is another option that was given. Could choking be the possibility? No, because externally in choking, you're just going to see generalized signs of asphyxia. You will need to dissect to see that there is some foreign material which is blocking the airways, right? So what is left? You have smothering. So smothering is the right answer. Now, What happens in smothering is that there is going to be lacerations or any sort of damage on the inner aspect of the lips, or sometimes it may even dislodge a tooth. The frenulum usually gets torn, and there could be contusions and abrasions on the nose as well, because in smothering, an attempt is made to close the external nares and the mouth at the same time to prevent the person from breathing. Now, if you remember, this was covered in our classes, and I'm just trying to bring your attention to this, where over here, bruises on the inner aspect of the lips, a frenulum tear, abrasions over mouth and nose. Covered this, hand pressing over external nares. This is covered under mechanical asphyxia part 1, the lecture notes, and also it was in our PYQs, MCQs and recall sessions. Next, a 27-week gestation with congenital anomalies. Okay, whom among the following is not required for authorization of MTP? Now students, first and foremost, the main operative word over here is authorization. Okay, actually speaking, none of these people who have been given the options have the right to authorize this. Authorization can only be done by a judge, okay, or maybe even a medical board if we are a little loose with the terminology, right? But it cannot be done by any of these people. However, whose opinion is required? Here you will need an obstetrician's opinion, sonologist and pediatrician's opinion. You do not need a lawyer's opinion. Therefore, the right answer would be lawyer. Okay. Now, what is this actually talking about? This is actually talking about the MTP Act. We discussed this in brief, but over here I just want to draw your attention to one thing, which is that above 24 weeks, the appeal would be to the medical board in case of substantial fetal abnormalities. And this is from the Government of India, where you can see the same thing highlighted, where a medical board consists of gynecologist, pediatrician, radiologist or sonologist, and such other number of members as may be notified in the official gazette. So basically these three people. Now this was covered in sexual jurisprudence part 3 and also in previous year questions. This has been asked. This time a lot of questions have come from the MTP Act. Question number 10. Which of the following chelating agents is not indicated in iron overdose? Now, I saw a lot of students get confused with this and they got very upset with this as well when I explained the answer to them, because they thought that it was a straightforward question. And it is. If you know certain mnemonics, there are certain ways you can fix this. However, even if you didn't know it, by common sense, if you have studied the entire subject of medicine, you would easily be able to solve this. I'll give you both ways, right? Now, first, if you knew it straightforward, you would remember that there is a mnemonic, which is mica, okay, where M is methyl mercury, I is iron, C is cadmium, and A is arsenic gas, right? This mica over here, right? This is where BAL is contraindicated, okay? Now this was provided. I did mention this in class. However, even if this was not provided and you just read medicine, then you could have still solved it, and I'll show you how on the next slide. Now, just take a moment to look at this. The approach over here is to note one thing, which is when there is iron overdose, which organs are hit the most? The organs which are hit the most are going to be your liver and your kidneys. So therefore, which is the chelating agent that you cannot give in a case where there is liver failure or any damage to the liver? Desferrioxamine is the drug of choice in iron overload, so it is not even one of the options you will take into consideration. Calcium EDTA can be used, okay, so this is also correct. EDTA can be used sparingly, right, very sparingly when kidney and liver are damaged. However, British anti-Lewisite cannot be used at all if the liver is damaged, okay, and this I have dealt with before. It is there in the metallic poisons part 2 video lecture. Also it's there in the lecture notes and MCQs and previously asked questions, and also in the crash course. Okay, question 11. A 14-year-old survivor of SA with 22 weeks of gestation has been brought for MTP. Which of the following statements are true? First one, MTP can be done in second trimester only when the mother's life is in danger. MTP cannot be carried out after 20 weeks. one doctor is involved, MTP can be carried up to 24 weeks. Now we know that this is not completely true. No, MTP can be done very late into the pregnancy as well, provided there are significant congenital abnormalities, or even if the mother's life is in danger. So that is wrong. Next, can it be carried out after 20 weeks? Yes, the new amendment that has come says that it can be carried up to 24 weeks. Previously it said up to 22 weeks, now it's saying up to 24 weeks. One doctor is involved. No. So before that used to be the case, but now you would need two doctors. So this is also wrong. The correct answer would be can be carried up to 24 weeks. Now let's just go through the approach over here. The question is actually quite straightforward. You should note the key points. They said that it's a 14-year-old, so therefore this person is a minor and POXO Act will apply. Now why is that important? Because under POXO Act, all pregnancy in minors is due to SA, okay, as per the POXO Act. Then before it was 22 weeks for MTP, now it allows for 24. And what grounds are these? Well, it's because of the SA that has happened. And students, how to approach this? Please keep this table in mind. You never know when it will come in handy. But what are the differences between 1971 and the 2021 amendment? The main differences over here are going to be that at 12 to 20 weeks, you needed opinion of two doctors. Now you need only one doctor. Between 20 and 24 weeks, it was not allowed before to do MTP. Now it is allowed if two doctors of the same category are opining the same thing. And beyond 24 weeks, an appeal to the medical board can be done. Now, this was covered in the Sexual Jurisprudence Part 3 video, also the lecture notes and the previously asked questions. I hope you guys have gone through it. I'm sure you would have answered wonderfully. Now, question 12. A woman desiring male child asked the radiologist to reveal the sex of her child via USG. What should the radiologist do? Now, students, I want to draw your attention to this little mark I have drawn over here. Now, this little mark means that this is a time saver question, okay, because the question is so simple that you shouldn't waste any time with it, okay. So I won't even bother elaborating much. Basically, they're asking about the PCPNDT Act, okay, and there's nothing crazy. We all know this. We have been told this repeatedly. You should not reveal the gender of the child to the parents. Why? Because there is a preference for male children in India and female feticide is a problem. So therefore, you will not reveal it. So what will be the right action to do here? Let's just go through the options. You'll get the answer immediately. Okay, let's go from bottom up. Can you refuse to do the ANC? No, you cannot do that. Can you do routine ANC and not check the sex of the baby? Yes, you can do that. Okay. What's the other one? Do routine ANC and check the sex of the baby for developmental abnormalities? Yes. And reveal the gender? No, you cannot do that. Then you have do routine ANC and check the sex of the baby for developmental abnormalities and do not reveal the gender. Yes. Option 1 is way better than option 3. Okay, because option 3 does not talk about checking for any sort of congenital abnormalities or any sexual developmental disorders, right? So 1 is a much better option. So quickly you can answer option number 1. Okay, question 13. A factory worker presented to the OPD with elevated urine copropophyrin levels. Which of the following poisons is likely to have caused this? This is very straightforward. I hope you guys remember. It's not going to be copper, it's not going to be arsenic, it's not going to be mercury, it's going to be lead, because lead is known to cause anemia, right? By interfering in heme cycle. Okay, so the answer would be lead. I'll just go through the approach of it. This was also covered in class, is that lead has an inhibitory effect. Lead has an inhibitory effect in heme synthesis, especially on the enzymes of ALA dehydratase, porphyrin oxidase, and also furochelatase. And so therefore that will cause an elevation in all of these compounds. Very simple, very straightforward. This was covered in class. I hope you guys remember that it was covered in metallic poisons part 1 along with the lecture notes and MCQs and previously asked questions. Now that brings us to the end of session 1. Let's start. Now, the first question of session 2 was a woman went for checkup. USG showed 2 embryos with age difference of 1 month. Which of the following is this finding suggestive of? Now, the options are given are superfetation, superfecundation, fictitious child, fecundation ab extra. Now, fictitious child is not the answer, obviously, okay, because that would require that there is no actual child. Here the USG is proving that there are 2 embryos, so there are already 2 children. Fecundation ab extra is a little different. That talks about fertilization that happens due to basically semen from outside of the body, not basically it's ab extra, it's outside of where it's supposed to be actually. So that also does not fit. Now, most students got this right, but they got confused between superfetation and superfecundation. And there is nothing to get confused about if you remember what I told you about the letter T, which is that when there is a single T between these two words, between superfetation and fecundation, if you just remember that the one with two letter T's indicates two ovulation cycles, and two ovulation cycles happened at the gap of 1 month. And so 1 month is mentioned here, two T's are in superfetation, so the correct answer is superfetation. Okay, now what is the approach? Well, if you had gone through everything and you didn't need all this roundabout way of going about it, then superfetation means nothing but more than one fetus, right? So fertilization of two ova released in the different menstrual cycles, but by two different acts of coitus in proximity. So there are two separate men who have inseminated this woman at two separate dates, usually at two separate ovulations as well. And this gives rise to two separate babies. So it's a twin pregnancy only, but it's a single pregnancy. Now, what is superfecundation? Well, that is more than one fertilization, wherein which fertilization of two ova which are released in the same menstrual cycle are fertilized by two separate acts of coitus. Same thing over here, there are two fathers, however there's only single ovulation. There's twins, single pregnancy. This was covered in Sexual Jurisprudence Part 3, and it was also a previously asked question. Now, question number 2. A man presents to the clinic with the findings seen in the image. What is the diagnosis? This question is very straightforward. This is a spot diagnosis. Okay, it's not going to be lead poisoning, it's not copper poisoning, it's not mercury poisoning. Straightforward, it is arsenic poisoning. You can see the Aldrich-Mees lines over here, and you can see the raindrop pigmentation on the palms. I have given a mnemonic as well in class for you to remember, which is nothing but arsenic B, which is A for Aldrich-Mees lines, R for raindrop pigmentation, and a bunch of other things. S for subendocardial hemorrhage, which is a postmortem finding. E for eruptions on skin and enteritis. N for neuropathy and neoplasms. I for iron oxide, which is sometimes used as an antidote. And C for cholera-like, because the symptoms that it produces are usually cholera-like in acute phases. And B for Blackfoot disease, and BAL as the antidote. This was covered in Metallic Poisons Part 1, also the lecture notes, and also the previously asked questions. This has been asked previously, so this question was sort of expected. Question number 3. A woman was operated on for elective C-section, then developed intractable PPH, postpartum hemorrhage. So a hysterectomy is done to save her life after all conservative measures have failed. Which of the following statements is true? Okay, so all the information that I can get from this, first and foremost, elective C-section, it was not emergency. But then she developed intractable PPH. So hysterectomy is done, okay, to save her life after all conservative measures had failed. That is the key operative line over here, because this means that this was a life-saving procedure. From an elective procedure, it became an emergency procedure, which means the doctor is protected. Okay, and that is in the options. Yes, the first one, doctor is protected because it was a life-saving procedure, is the first option. I thought it will be later. Okay, doctor exhibited negligence toward patient. No, he did not. Counseling of the relatives is not needed. It's an emergency procedure. You do not need counseling of, no. Consent for hysterectomy should have been taken on OT table. No, this is ridiculous. If the person is on the OT table, how will you take it? No. But yeah, some students did mention that it could be consent of the husband or family, which was mentioned in option number 4. But even then, it wouldn't be taken because it is an emergency procedure. Okay, so not at all required. The correct answer is 1, because the doctor is protected. This comes under what I was talking about as a time-saving question. You just look at the options, quickly eliminate, move on. Question number 4. A person died in an RTA. Who can order autopsy in this case? Defense lawyer, public prosecutor, investigating officer, forensic expert. Again, time-saving question. It's a nonsense question, actually speaking. Defense lawyer, prosecutor, public prosecutor have role only in court. They have no role in the autopsy procedure or even ordering the autopsy procedure. Forensic expert can suggest, okay, but they cannot order one. Ordering is done by investigating officer. So this is the correct answer. Okay. Okay, question number 5. Person presents with features of tachycardia, hypertension, dilated pupils, agitation, and diaphoresis. Which of the following is the most likely poison? They've given options of morphine, chlorpheniramine, heroin, and cocaine. This is very straightforward. All the symptoms are autonomic in nature and they seem to be more towards the sympathetic rather than the parasympathetic side. It cannot be morphine because morphine is known to depress the CNS. Heroin, again, that also. Chlorpheniramine, they would have mentioned flushing or something to do with the antihistaminic action, right? There'll mostly be flushing of the skin or a sudden vascular collapse, something along those lines. So cocaine is the best answer. Don't waste time with this question. Keep it moving. Question number 6. The range of fire by a rifled firearm shown in the image is. Now, I heard some students say that in the image provided for them in the exams, there was significant blackening that was seen around the edge of the wound. Which is fine. Some are saying it's due to burning, some are saying it's because of the smoke or the soot or whatever it is. Whatever it may be, considering the options given, it becomes very clear what the answer is. Because if all of these things have happened, right, then there is only one range it can be. Now, first and foremost, let's look at the options and do an elimination. Option number 4 says cannot be determined. 100% that's wrong. I can determine. We can definitely determine. I have taught you this in class. Next, if it's a distant shot, then you won't have all of this tattooing, blackening, and possible singeing of hair. You'll only have the circular bullet hole, right? The defect. So that is also not a possibility. Contact shot, if it was a contact shot, first thing you would see is you would see a muzzle imprint, okay? Or second thing is you would see splitting of the skin, because as the gun is launched or fired, the gases that escape will go into the subcutaneous space and then try and come back, and that will tear the skin open, right? So you'll get that blowback effect. So therefore contact shot is also out of the question. Only close shot makes sense. Now the approach, I hope you guys remember, I did talk about this in class. This is usually what you're going to see in a close range of rifle injury, where you're going to see a central bullet wound, bullet wipe or grease collar, which is right around. Then you'll see abrasion collar. Sometimes there may or may not be a contusion collar. You'll see burns and singeing, blackening and tattooing. Now I did give an even easier one in a video, and I have video proof also of myself teaching this very same thing in a short way, in an easy way to remember. I hope that you guys remember this part. I specifically said, so remember, if there's only bullet hole, it's a far range or a distant range. There's only an entry wound. If there's bullet plus tattooing, then it's near range. If there's bullet, tattooing and singeing, then it's a close shot, which is what we saw in this picture. All of the above plus muzzle print means most likely to be a contact shot. Now, extra tip over here, watch the video. You'll get to find out what I was talking about. But apart from that, this was covered in ballistics part 2, which was terminal or wound ballistics. And also this has been asked multiple times, and I did bring this to your attention when taking class as well. Next, question number 7. A 30-year-old male dead body was brought for autopsy. The doctor notices white waxy material and preserved facial features. Which of the following is true about this case? See, already they have mentioned that there is waxy material and preserved facial features. I already know that they're talking about Adipocere, right? Immediately you should know that they're talking about Adipocere, okay, or grave wax, it's sometimes called. Now let's look at the options. What could it be? It happens in hot and dry climate. No, this is wrong. It happens in hot and humid climate, right? There needs to be moisture. Then let's see another option. High temperature is needed. Yeah, that's sort of correct. Warm temperature is needed, not high. Warm temperature is needed. High temperature may be working against also, because most enzymes of the human body don't work very well at a very high temperature. So I would actually even cancel this option. It starts very early after death. Not always. So usually they say it's from 3 days to 3 months. The earliest they've seen is 3 days, but that's not very early after death. Decomposition starts at 18 hours, so it's not early. So it is the preservation of body by saponification of fats. This is the best option. Why? Because adipocere means saponification of fats. It's quite literally the definition of it, right? So there should be no confusion regarding this. Now, what is the approach? I hope you guys remember that we even put up a video on online for you guys, on YouTube for you guys, to go through all of this. If you just go through it again, you'll notice that all the basic things regarding this case, Adipocere, all of those things were covered, right? So I'm just drawing your attention to a few things, which is that lecithinase enzyme is very much required in this, and also it involves the hydrolysis and hydrogenation of the fat in the body, leading to fatty acids, and finally adipocere with addition of calcium and ammonium, right? It can happen between 3 days and 3 months, and there's a sweetish odor. The injury features and facial features are preserved, so it helps in estimating time since death also. This was covered in taphonomy part number 3, lecture notes, and also previously asked questions. Now, question 8 says, a group of people have consumed contaminated alcohol and present with abdominal pain, confusion, decreased vision. Methanol poisoning is suspected. Okay, they're directly given it. Okay, what metabolites will be found? Now, if methanol poisoning wasn't given, you should have already figured out from decreased vision, contaminated alcohol, abdominal pain, and confusion. Okay, basically, this what they're describing here is known as a hooch tragedy. Okay, a hooch tragedy. What this means is illicit liquor has been created, and that is being given to people, adulterated liquor, and that usually involves addition of methanol to the ethanol, and that causes ill effects because methanol in your body breaks down to formic acid and formaldehyde, and formaldehyde later on lactic acid. So if you're looking at these options, what do you think the answer could be? Glycolic acid and oxalic acid do not happen here. You're more likely to get that with ethylene glycol poisoning. Formic acid and oxalic acid, no. Again, no. Glycolic acid and formic acid, no. That also is not it. Formic acid, lactic acid is the best option here. Now, what is the approach to this? Now, if you remember methanol poisoning, I did mention in class, methanol gets converted to formaldehyde and formic acid. Both are more toxic than methanol by itself. Formic acid is known to cause severe acidosis, specifically high anion gap metabolic acidosis, and also blindness. So therefore, that's the reason they were having visual disturbances. If they ask in future, you should know it's called snowfield vision because there is retinal and optic nerve damage. Now, this is covered in CNS depressants part 1, also in the previous year questions. This has been asked before. So if you've gone through the previous papers, you would have definitely answered this quite easily. Okay, question number 9. Microscopic image of organism was analyzed in a drowning case. Which of the following statements is true about them? Okay, what is this image given? Okay, now I know what this is, right? Clearly they're asking about a diatom. Okay, now what are diatom? Diatoms are microscopic unicellular algae, okay, which are covered with something called a frustule, and that frustule is usually made from silica or chlorophyll. Okay, and this frustule is very resistant to acids and heat, so they survive in very extreme climates. Now, if it is present inside the human body because a person has inhaled water, then it will enter the circulation and it will go all over the body, go into all of the organs, and also go into the bone marrow. And this can only happen if the circulation is active, so it can help in proving that the drowning was ante-mortem. Now, taking all of what I have said to you right now, let's go through all of the options. Which do you think will be correct and which do you think will be false? First one, which is number 4, it says are not resistant to acids and heat, which is very false. Then it says present only in bone marrow. That is also false. It can be present in lungs, it can be present in liver, it can be present in the heart also. Anywhere where the circulation goes, it can be there. Are microscopic unicellular bacteria? No, it is algae, not bacteria. So this is also wrong. Contains silica and chlorophyll. Yes, silica because it needs the hardness, and chlorophyll because it is algae. It needs to photosynthesize. Now, what would be the approach to this? If you guys were paying attention in class when I went through diatom test, then you would have remembered these are microscopic unicellular algae covered by silica, chemically inert and easily immune to very strong acids, right? And it is proof of ante-mortem drowning if it is present in the bone marrow. It can be found in decomposed bodies as well, not usually found in post-mortem drowning because no active circulation, and not found in dry drowning because water rarely ever enters the body. Now, For those of you who are worried, oh, what about the fact that it doesn't only go in the bone marrow, it goes to other places? That also was covered, right? We did go through it. See, it enters different organs because it enters the systemic circulation from the pulmonary circulation. If a person has passed away, it stays in the lungs, does not circulate beyond. Now, this was covered in mechanical asphyxia part 3 and also in the previous year papers, and also very importantly in the recall sessions. I did go through this and say this was definitely a question that they would ask. Lucky guess. Question number 10. A patient comes to casualty with history of consumption of unknown substance. Patient shows dyspnea and hypotension. High anion gap acidosis is noted with hypocalcemia. Okay. Few things to draw your attention to. Firstly, unknown substance. Okay, so immediately they're telling you need to find out what the poison is. Then they've told you that there's dyspnea, hypotension, high anion gap acidosis, and hypocalcemia. Now, first and foremost, we know that it's not Datura. Okay, it's very unlikely to be Datura because then you will have other symptoms as well, right? We just went through the 8 Ds of Datura fastosa. Yeah, so none of those features are consistent with what we're seeing here. Ethanol poisoning, no, you're not going to find all of these. It causes a lot of things, but it doesn't cause this syndrome of descriptions. Then you have methanol and ethylene glycol. Between these two, I can understand your confusion. However, the thing that clinches it for me is the fact that they have mentioned hypocalcemia. Hypocalcemia is seen with ethylene glycol. It is not seen with methanol. So the correct answer here would be ethylene glycol. And this was covered in our notes. Now it is weird because before things like this were kept under the may know, but a lot of questions have come from ethylene glycol, and I did mention this very specifically, especially when we did the previous year questions and recall sessions, that they're asking a lot of questions from ethylene glycol, specifically with respect to the calcium oxalate crystals, bihydratic and monohydratic crystals, which is envelope shaped and dumbbell shaped crystals that you'll find in the urine. And this time they have asked it in a slightly different way, so please commit this to memory. You never know when it will be helpful. Question number 11. Again, this is a question which is very straightforward. We shouldn't waste time. A 21-year-old female patient presents with 10-week pregnancy and wishes to undergo MTP by medical methods. Okay, which of the following would be most appropriate, I'm guessing? Okay, so the thing is, first and foremost, at 10 weeks of pregnancy, we don't usually do medical methods anymore. Usually we go for a combined method, but it's okay. Let's run with the question because they haven't given option of none of the above. So we'll run with the 10 weeks of pregnancy and go through all of these. The best option would still be mifepristone and misoprostol. As you know, the abortion tablets that are there, these would be the best bets. Intrauterine hyperosmotics would not do. This is usually because it would either be an IP or OP procedure. This would be an IP-OP procedure. Just medically would not be enough. Dinoprostone is not recommended to be used as a medical method within the first, if I'm not mistaken, as a means of MTP, first 10 weeks. I still think mifepristol and misoprostol is the best idea. This question will be dealt with more in detail by obviously obstetrics and gynecology. However, the answer over here, the best possible answer over here is mifepristone and misoprostol. Question number 12. A chronic alcoholic presents in need of bowel surgery. Which of the following drugs should be given to treat the withdrawals? So actually the first part of the question becomes irrelevant. Which of the following drugs should be given to treat withdrawals is the actual question. Options: lorazepam, methyl alcohol, fomepizole, buspirone. I mean, this is quite straightforward. We know that the drug of choice to treat withdrawals is going to be benzodiazepines. Chlordiazepoxide is the drug of choice actually, but diazepam would have also done. If they've given lorazepam, that is the answer. Methyl alcohol is not used in treatment of anything. Fomepizole is used in the treatment of methyl alcohol. Buspirone is used for generalized anxiety disorder. I don't know how they thought this will be a good distractor, but lorazepam is the right answer. And lastly, for the endpoints, we noticed that this time we had a 100% strike rate. That is, if you went through all of the notes and all of the lectures, even the crash course previous years, there is everything that was covered in our app. And again, I want to congratulate all of you for your hard work. I know many of you have put in tremendous amounts of effort to write this exam and ace it. For those of you who feel that you've not done well, don't worry. There is always a tomorrow. There's always a next time. You're given your best. Do not let all the external pressures get to you. And also, one very important thing I want to tell you is Manipal MedAce is here to help you. We are trying to make sure that you secure the rank that you want. So therefore, I just want to tell you a few things. We do offer personalized study plans where you can decide what your weaknesses and strengths are. Also, all of our content is faculty driven. We are the ones creating it. Students are not creating it. And most of our tests are very similar in terms of the nature of questions and the style of questions to what you're going to get in your entrance exams. So if you get a chance, please do subscribe. Thank you so much for watching, and I hope this helps.